Hello, this is Dr. Gay from First Lake MRI, and this is a 53-year-old male who had an injury of the leg, knee, about 4 days ago. Since then, he's had really bad knee pain, and it's most pronounced posteriorly. And we have two views here, both in the sagittal planes. We see the kneecap here on the left, the femur here, the tibia here. This is the front of the knee, here's the back. On this view, fat is suppressed. We call it a fat suppressed view. So all the marrow that has fat in it is dark, the subcutaneous fat is dark, and this view is not fat suppressed. So all the fat is bright, it really stands out. The patient has a big joint effusion above the kneecap. This is the suprapatellar pouch above the kneecap. You can't really see it very well in this view because the fat and fluid are the same signal, and then just doesn't stand out. But on this view, where they're a different signal, really obvious large joint effusion. And this is where fluid often accumulates with the knee. This is a low pressure area, so when they have fluid in the knee, it'll preferentially go up here and expand this suprapatellar pouch. So if you have an injury, you may notice this funny bulging above the knee, and it's just because that's where the fluid goes, above the kneecap. Now there's another problem which is down here. There's another area that's really bright and abnormal, and this is what we call the popliteus muscle, right back here behind the tibia. If we put up this view, we see the popliteus muscle back here is diffusely edematous and really expanded. Normally it's a smaller, it should be much smaller than this, but it's about twice as thick as it should be. It looks like it's bulging outwards, backwards here. And so this is a worrisome finding. Sometimes people will have an injury, like this patient, where they have a strain or partial tear of the popliteus muscle or some other muscle, and whenever the muscle swells from the injury, it will cause increased pressure within the muscle, and then the increased pressure can be so high that it will restrict the blood supply. We call that compartment syndrome. And when there's a restricted blood supply, the muscle can die or necrose and can cause permanent damage, permanent atrophy. So this is something that can be very painful, and it's something that needs to be treated right away. So we're going to send the patient to the orthopedic surgeon and then have them evaluate. If they think the patient needs to have immediate treatment, this can be a surgical emergency. They'll go in and do a fasciotomy where they make an opening in the muscle to relieve the pressure, and then the blood flow can go in and the muscle can go on to heal. But if they don't do that, again, this is at risk to just necrose and atrophy away. So in case of an injury of the popliteus muscle, then the expansion here makes us worry about possible compartment syndrome. And so again, that needs to have clinical evaluation and possibly a fasciotomy. Thank you very much.